America is facing a healthcare crisis that is unnecessary, and it's happening under this president's watch. Congressional Republicans spent the summer slashing more than $1 trillion from the Medicaid program. This will threaten health care for 11 million people and jeopardize rural hospitals all across America. Small-town hospitals, many of them, will not survive. Despite the president's promises, prescription drugs are still unaffordable, and Big Pharma continues to rip off American patients. And now, in just 6 short weeks, more than 20 million Americans will see their health insurance premiums double or even triple. Imagine, if you will, when you take a look at what you paid last month for health insurance, that it's going to double January 1st or worse. Tens of millions of Americans are terrified to look at their premium notices because Republicans have refused to extend the enhanced premium tax credits that made insurance affordable. In red states and blue states, for families, small business owners, farmers, and Americans nearing retirement, the peace of mind that health coverage brings will soon be out of reach. With these tax credits set to expire, 4 million people will lose their insurance because their premiums become unaffordable. There will be one sickness, one accident, one diagnosis away from absolute financial ruin or worse. Housing, utility, and grocery prices have gone through the roof already. Who can also afford to see their health care costs for their family double or triple? But President Trump and his billionaire buddies are out of touch. They don't have a clue what it's like to live paycheck to paycheck and what the loss of health insurance means to a family. As United States senators, we can change that. We have the power to prevent these dramatic premium increases and avoid a health care catastrophe. But to use that power requires both courage and compromise. As part of the agreement to reopen the government, which I voted for, the Republican leader promised to put a bill on the floor, one chosen by the Senate Democratic side, to extend the enhanced premium tax credits. So shortly after Thanksgiving, after we enjoyed a holiday with our families, senators will come back to Washington and make a fateful choice for American families across the nation. Will we sit idly by while millions of Americans lose their health care coverage? Or do we sit down, Republicans and Democrats, and solve this problem? Why were you sent here to the Senate? Each senator has their own explanation. I believe I was sent here to make life better for the people who live in my state and this nation. Can we find common ground? Can we reach an agreement? Can we do something that really makes a difference in the lives of our constituents? If we do it, they will be absolutely mystified to believe what they believe to be an incompetent Congress could rise to the occasion. The answer to this question is going to be closely watched by millions of Americans. With each monthly premium payment or skipped doctor's visit, patients are going to be reminded of what we here decided to do. Wouldn't it be amazing to end this year and start a new one by doing the right thing for these people who are victims of legislative decisions? I was on the floor of the Senate 15 years ago. It was one of the most important votes I cast to create the Affordable Care Act. Do you remember what life was like before the Affordable Care Act? I can tell you a few highlights. If you had a pre-existing condition or even the hint of such a condition, you either couldn't get insurance or it was limited in its coverage to a ridiculous level. You also had a situation where most health insurance policies never covered mental health or addiction. I remember what happened on the floor of the Senate when we debated this issue. Why wouldn't it be covered? Why wouldn't we take mental illness as an illness and not a curse and something that can be treatable? Well, 2 senators stood up and argued to do that. One of them was Paul Wellstone. He used to sit right back there from Minnesota. He was a character. I loved him. We all did. A college professor, took a beat-up old school bus and got elected to the Senate from Minnesota. A member of his family had mental illness. And Paul Wellstone argued we ought to do everything we can to help them and first and foremost, make sure basic health insurance policies must cover mental health and addiction. He had an unlikely ally who used to sit in that seat there to my right, Pete Domenici of New Mexico. He'd been in the Senate for quite a few years, a Republican senator, highly respected, who was one of the leaders in the Senate and had a child born with a mental illness. He teamed up with Wellstone. What an odd couple politically, but they got it done so that you couldn't buy a health insurance policy in this country that didn't cover mental illness and addiction. They didn't know at the time, none of us did, that we were going to face an opioid crisis and the addiction problems would not be confined to poor minorities, but would touch many families who thought they were well beyond the reach of that scourge. That provision was guaranteed by the Affordable Care Act. The insurance companies did not want to include it in their policies. We forced them to do it. And now to walk away from that kind of protection is unthinkable. There was also a provision which was basically practical. We said if you have a family health insurance plan that covers your children, it will cover them until they reach the age of 26. Why would we want to extend to age 26? Because during that period of time, your son, your daughter will be finishing college, looking for their first job, maybe struggling to make student loan payments and try to get off on their own. And we were going to give them a helping hand by allowing them to stay on mom and dad's health insurance plan. It's very simple, it's very logical, and it works. Are we going to give that away as part of the war against Affordable Care Act? I certainly hope not. We can make the Affordable Care Act better, that's for sure. There are things we can do to reduce the cost of health care in America. One of them is pretty obvious. Ever turn on the television recently and not see an ad by a pharmaceutical company? I doubt it. Almost every minute, night and day, they're running ads to try to entice Americans to ask for expensive prescription drugs. It's one of the main drivers in the cost of health care going up in America. How many countries allow pharmaceutical companies to advertise on television like we do in the United States? Only one other country in the world allows that, New Zealand. New Zealand. Why do the pharmaceutical companies want to do that? They want to entice you to ask your doctor to prescribe a drug that may help you. They reached a point where Americans across the board can not only pronounce, but can spell Xarelto. We've heard it so often, over and over again. To ask a doctor for that drug is not uncommon because it's been suggested to you 3 times a day, every day for months. The American Medical Association and others say this is wasteful. People should be prescribed the drugs they actually need rather than those that just might help them in a remote circumstance. Little things like that can make a difference. Senator Chuck Grassley and I introduced a bill to stop direct-to-consumer advertising on television. It actually passed the Senate a couple of years ago. Let's go back and make this part of the future of healthcare in America. After we have restored the tax credits that families desperately need immediate help on. There's no excuse. We're going to have a new year coming soon, just a few weeks away. Families look forward to it and the opportunity. Give them a better life for millions of Americans by giving them help with tax credits to pay for their health insurance premiums. That's the reality of where we are. I'm committed to this cause because I know it really makes a difference. And as I said before on the floor, at one point in my life as a young father with a little daughter that had a medical issue, I had no health insurance. I felt helpless. I don't want that feeling to be spread across America because of our lack of ability to reach a compromise. We can and we must. Rising premiums affect constituents in my state. They affect those in Texas and South Dakota, Louisiana, Florida, Kansas, Wyoming. I believe that basic elements of an agreement are achievable. If Republicans are serious about preventing catastrophic premium increases, let's get together and get it done as soon as we return from Thanksgiving. We don't need to hold health care hostage to add an extreme issues on as conditions to pass it. We need to undermine a deal. We shouldn't undermine a deal to meet political goals. Let's do something right for the families in America. They will be just amazed that we did, but they should be. Global issues, such as proposals by Senator Sanders of Vermont, Medicare for all as an option to health insurance, are worth the debate. Proposals by Senator Cassidy of Louisiana to privatize health insurance are worth a debate. There's no question about it. Let us make that the second item on the agenda after we provide tax credits to help families pay for these health insurance premiums. We can't upend the entire healthcare system of America by January 1st of next year. Let's get the highest priority done right away before Christmas. We have an opportunity, we have a responsibility to help Americans afford their health care, and that starts with a bipartisan vote in the Senate. I hope my Republican colleagues will not waste this opportunity, nor should the Democrats waste it either. We need to make a real and positive difference for the people of this country who are counting on us. Thank you, Mr. President. I yield the floor and suggest the absence of quorum.